Our next speaker is Alex Ireland. He's a reader in musculoskeletal physiology from Manchester Metropolitan University, and he's going to talk to us on neuromuscular health and function in children with osteogenesis imperfecta. So thank you very much indeed, Alex.
Thanks. Can you hear me okay? Great. Well, thanks very much for the invitation to talk about what I think is a really important topic. Now, we're really at the start of understanding muscle in OI, so this is really kind of an overview on the brief amount of information that we have. So these are my disclosures. So I'm going to talk really about why is different aspects of muscle function important to everyday parts of our life. Why is it that OI could directly or indirectly affect it? What do we know to date about muscle function in OI? And more importantly, what can we currently do about it? So just thinking about muscles function, we often think really about strength as what muscle does, but it has to do lots of different roles which are important for different parts of our life. So it has to be powerful, it has to produce large forces very quickly to allow us to lift out of a chair, to go upstairs, to arrest a fall if we do trip. It also has to be very forceful to produce large forces because these guide the development of a healthy skeleton during childhood. Now, as we were enjoying our really nice dinner, our lunch, we had to use very fine motor skills to do that as we were getting dressed this morning. So we also have to be able to move very skillfully to do everyday tasks. And even at the whole body scale, we have to be able to do whole body tasks very skillfully. So we have to be able to sit, to stand, to walk accurately to prevent falls and fractures. And we also have to be able to do all of these things without becoming too tired. More than that, muscle can also have effects on the rest of our body and the rest of our health. So muscle is the main user of energy in our body, and so it has a critical role in keeping our metabolic health in good condition, and that can have implications. So muscle is important for ensuring that we don't get cardiovascular disease or diabetes, etc. And finally, it also sends out chemical signals to other tissues in the body, and it can actually help them to recover. So if we have surgery, if we have a fracture or another kind of injury, these chemical signals from the muscles, if they're healthy, can make them repair much more quickly. And so all of these things are important, and there are reasons to suggest why they might be impaired in osteogenesis imperfecta. And actually the ones I've highlighted in bold are those that we have really good evidence that actually there are deficits in function. And it's not that the rest don't have deficits, but there's just not the same level of kind of quantitative information. The studies aren't there. So clearly, lots of aspects of muscle are affected. And just to give you an example, this is a study in children with OI type 1, and we can see that in comparison to controls, when they jumped, they were able to produce about 25% less force, and they also produce that force much more slowly. So we have weaker, slower muscles in these children. And it's also not something that just affects the lower limbs. So again, this is a study looking at children where they looked at function across different parts of the body. So 0 would be typical values in a child without OI, and -1 would be about the lowest 16%, and then the lowest 2.5%. So we can see across different body parts there are deficits. So it seems to be something systematic that affects the body. But it's not every child with OI. So some children with OI type 1 are perfectly able to play soccer, to play rugby and participate in athletics. Others are really affected in terms of mobility. So you can see here around 40% of the children were able to get a typical value in the power tests, but we're interested in that 60% and how they're affected. And again, it doesn't seem that all of our types of function are affected in the same way. So again, you can see that there were much fewer of the children were able to produce a satisfactory force test than a power test. So what we really need to be able to do is to target the children who have problems and understand the relationships between different aspects of function. Does it mean that if your balance is poor, your strength is poor, etc.? So we've talked about describing the problem really, but in order to help it, we have to understand what's going underneath. And this is where kind of my work as a scientist comes in. So the system of actually getting you to walk, to do up your clothes, etc., is very, very complex, involves sensory system, the brain, the nerves, the muscles, tendons, as well as the bone. And there's reasons to think that lots of these areas in this system might be affected. And just to run through a few, collagen is involved in proprioception, our kind of feeling, which we use to guide balance and movement. We think about the planning of movement in the brain and also the nerves that send the signals, the size of our muscles, the way that once force is produced, it's transferred across the muscle. Our muscles also act, and tendons act as springs. So if I'm running, as I land from a step, my muscle, my tendons stretch like a spring and store energy, which they then use for the next step. And again, the collagen is really integral in that. So lots of possible factors and reasons why we might think that OI would affect muscle. But again, today, only a few of them appear to have been quite well explored, although we do have the capability to explore all of these in detail. So just to give you a quick example of how we might do that quite simply, we've mentioned balance is impaired with children with OI. So you see, this is the measure. We ask children to do a standing balance, and we measure the path of their balance. So the wobblier they are, the longer the path we record is. So you see that children with OI type 1 had a longer path, were more wobbly than children without OI. But when the scientists asked children with OI to close their eyes, so denied them the ability to use sight as a kind of way to guide their movement, children with OI were more affected their performance than children without OI, so suggesting that they might lean on the visual system to help them with their movements more than children without OI. And that suggests maybe that things proprioception, our body's feeling of itself, might be affected in OI. And as I've talked at first about the kind of direct effects on that system, but there's also indirect effects, other parts of the body that might impact on our ability to move. So we could imagine that in OI, physical activity might be affected, particularly after we've had fractures. Again, we don't know to what extent diet differs. The bone and the muscle signal each other with chemicals. And again, if the bone is impaired, then the ability to signal and keep the muscle happy might be impaired. Our muscle is fueled by the oxygen, by nutrients that are sent by the respiratory and cardiovascular system. So if they're not working in the same way, that will impact us. And we're talking a lot in this session about pain, which you could understand. If we have pain, it really might restrict our ability to do different tasks. So again, lots of indirect ways in which our movement might be affected, but again, very little to explore their influence. And again, just to give you an example, so this is a study where they saw that lung function was lower in children with OI type 1, and also that their ability to uptake oxygen, so how much oxygen they could use every minute, was lower than children with OI, without OI. And again, that might affect your ability to do things like endurance events or not to become tired. So sorry, I've painted a very negative picture, and there are a lot of problems potentially. So what can we do about it? Is there anything we can do to address these problems? There's not a huge amount out there at the moment, but there are some studies looking at interventions. So this was a physical training study which did light weights and aerobic exercise in children with OI type 1. And we can see that they were able to improve the strength of the children over 12 weeks by quite a lot, 15% or so relative to the controls. But that sort of waned after they stopped exercising. And there was some evidence, although not quite as strong, that actually improved fatigability as well. So exercise might be effective. Has been a trial, you may have seen these machines in the gym, these sort of wobbly plates, you can do exercises on them and they're supposed to be very good for your muscles. And in a study in children with OI, it did make the muscles bigger, but they looked at lots of different types of function, as we mentioned, mobility, force, power, etc. And whilst it made the muscles bigger, it didn't translate into improved function. And then finally, some of the drugs that are given to improve the bone in our OI seem to be related to improvements in muscle. So we see here improvement in muscle scores when children have had bisphosphonate therapy. Now, we don't know today whether that's a direct effect. Does the drug actually affect the muscle itself? Or is it the fact that because the bone's improving, there's less pain and so they're better able to move? Or is it kind of an indirect effect? Again, if the bone's improving, it gives better chemical signals to the muscle and helps it that way. So just to bring it all together, again, it's just a brief overview, but there do appear to be really large deficits in muscle function evident in children with OI. There's only a small amount of evidence in children, but there's even less, very little in adults, so we believe the same sort of things are evident. Again, multiple components of function, balance, endurance, strength, power, etc., all appear to be affected, and they will relate onto different aspects of everyday life. But we don't know how different people are affected, whether one's related to the other, etc. Like many areas of study, it's focused generally on individuals with type 1, so our understanding of other types isn't well known. And actually we have to think, are the aspects of function that are most important for people with type 1 the same for people with other OI types? We might have to think about which aspects of the muscle are most critical to everyday life. As I said, likely multiple causes, both to do with the biology underlying OI and also kind of environmental and other sort of factors. But to date, we've not explored a lot of them. But there is some evidence that there are kind of effective treatments in terms of both exercise and drugs that need to be explored further. So really, it's clearly an important topic. We do have some clues from some excellent work so far, but I think it's really an under-resourced and under-researched area. Thank you.
Thank you very much. Questions from the floor? Alex, can I just ask you one whilst we're waiting? I'm interested in your bit about evidence from the trials. Are you aware in some of the ongoing trials at the moment, are they including any muscle assessments as far as the endpoints? And if they're not, should they be? And what might you put in, do you think? What would be the sort of assessments you ought to be doing?
There are usually some endpoints. I think it's understanding. Again, we're missing that understanding of all the different components. So I think we need a bit of a deeper understanding, first of all. So to what extent is balance affected? To what extent is force affected, etc., in order that we target the most appropriate ones. So, for example, we've done some studies recently in XLH, or another rare bone condition. And actually, when you look at hand grip, there's no difference between adults and with and without. And if you look at other measures, you find really big deficits. And so actually, if you were doing it based on the hand grip, which is a really common clinical measure because it's so easy and there's so much data on it, you would get the wrong answer. So I think we need to do a bit more of basic understanding of which bits are affected the most, and that would help us target things a bit better.
Thanks. Question, yeah.
Thank you very much for your talk here.
Hi.
It was very nice, and it's incredible to see the impact that so many things has in the muscle function. Can you specify a little more about what kind of exercise do you think that can help to improve the muscles function, or you don't have studied that?
There's very little scientific evidence. Again, I'm not a physiotherapist. I don't work with people day to day, so probably some of the clinicians would give better advice from that side. But in terms of the evidence that's out there, there are some really small-scale trials of things like aerobic exercise and light resistance exercise, so things that aren't likely to produce a high impact because we don't know about the safety of kind of running or other events as an intervention. But it's a bit of a cop-out. I think we just really don't know. We've not tested lots of different exercises for their safety and so on. It's been kind of quite a narrow group, again, only in individuals, children with type 1.
Do we have time for?
Yeah, thank you for a lovely talk. I may have missed it, but when you presented the data on the jumping platform, was it only for children?
Yes.
And do you have some data for like the whole lifespan where the OI patient is in compared to the normal population?
I think there's studies kind of in preparation, yes, but showing that there are deficits in adults as well. Yes. But we're not sure. You would imagine they would become progressively larger as things like osteoarthritis or other problems kind of produce additional effects. But there just isn't that strength of information out there to look at those age effects. But certainly, as you expect, most people without OI will have problems with muscle in their 60s and 70s. So can imagine it's an even greater problem, but just not explored yet.
Last question. Is it time? One more.
Thank you for your presentation, Lars from Norway. I'm just wondering, these trials and scientific endeavors, which time frame are we talking? Are we talking months or weeks or years?
I think it depends on the scale of what you want to do. I mean, you know, the interventions themselves should take a few months, but obviously they need to be funded, need to be written. Again, if we want to understand more at a basic level about what's wrong with the system or how OI is affecting muscle, we are probably talking for a full exploration, you know, maybe a decade, but there may be some things in the short term that we can do, you know, certain training exercise in adults, etc., that could be available in the next year or two. So I think it's a continuum of things. We'll learn more and more.
Thank you.